I've worked for the NHS for about 18 years now, and the pay announcement, we're angry about this pay announcement because in real terms we're actually not getting anything at all. It's not consolidated. We will be picking up pence in every salary each month. We're working more hours, we're doing more work with less staff, and it's just, we've not had a pay rise for 3 years.
I'm angry about NHS pay because I feel that we've been disadvantaged once again, and I feel that we've got, in the health service, we've got poorly paid workers on band 1, which is no pay, and people just can't afford to live anymore. We've not had a pay rise for so long, the rate of inflation's gone up, and we're stuck in with mortgages to pay, and the food prices are so unrealistic now. You go into the shop, what once cost you 30, 40 quid is now 60 and 70 pound. And people just can't do it. We've got members coming to us all the time and saying, we've got no money. There's some sad cases out there, and really the government should be doing something about it.
I'm angry about the government's pay announcement for NHS workers because it's not valuing us. It's basically saying it doesn't matter how little we pay the NHS workers because they'll just carry on doing their job. Basically, we need people to be valued in the NHS. We're losing good staff because they're fed up.
The pay rise that we're not getting, in my office there's only 2 people that actually qualify for the 1% pay rise, which is just a pathetic insult. All our workloads get increasing. I'm on a 15-hour contract, like a lot of my colleagues, but yet we'll do 600 extra hours a year. With no entitlement, we can't even get a pay rise now. Cost of living is just ridiculous. All our bills are going up. People are struggling in our area especially, and having to find other jobs as well.
I think UNISON members are incredibly angry about what the governments across the UK have done in terms of NHS pay. So it's been 1% in some parts of the UK, but in England in particular, where the government has basically decided to say it's a pay freeze for the next 2 years, and those at the top of the pay band will only get a 1% non-consolidated for 2 years. And this seems to me to be a deliberately provocative attack on NHS workers, where basically the Secretary of State is saying, we haven't funded the NHS properly, we now expect staff to pick up that shortfall by taking a further cut in their pay. It means we now have the go-ahead to run a long-sustained campaign about NHS pay, and also that the Executive will be requesting a ballot to be held of NHS workers for both strike action and action short of strike action. But that will be part of a long-term campaign, because this is a fight not just for NHS workers but for the NHS. Because if NHS staff feel undervalued, that they're not treated seriously by the government, that's not good for patients, because there's hard evidence that shows that where staff feel valued, where staff feel engaged, where staff feel their contribution is recognised, that actually has a positive impact on patient outcomes, including even mortality rates. So we're asking all of our members who work in health to go to the branch meetings, to make sure they're involved in raising awareness amongst all the people who work in the NHS that they are worth a decent pay rise, and that this is not just about saying we need more money for ourselves, which they do, but actually saying this is about protecting the NHS.